All right, everybody, welcome back.
Back for more.
We like to get straight into it here.
Absolutely no messing about.
We've had some requests to dive into the metabolic response to surgery. And, I love this stuff.
Oh, this is good stuff. Yeah.
It's vital for the MRCS. And just honestly for being a great surgeon.
Yeah, being a good doctor, full stop, I think.
Yeah, absolutely. So
Yeah.
think of it like your patient's body is on a roller coaster after surgery.
Oh, great analogy.
It's going through all these ups and downs, these ebbs and flows, and that's what we're going to break down today. So if you get this down, you're one step closer to acing those exams and delivering, amazing patient care.
Yeah, and that's what we want, right?
Yeah.
At the end of the day.
Of course. So let's plunge straight into the ebb phase.
Wow.
So what is actually happening here?
So this is like the body slamming on the brakes,
Like, whoa.
It's the initial shock response to surgery. So we see things like hypovolemia, maybe low blood pressure, a dip in that metabolic rate, even hypothermia, like the body's trying to conserve energy. And think about it, you'll see low urine output. The patient might be a bit confused, maybe even disoriented because there's less blood flow going to the brain.
Right. So it's almost like the body's in like this emergency mode, like just trying to protect itself.
Exactly. That's a great way to put it. And all those hormones are going crazy. Catecholamines, cortisol, aldosterone, all surging to minimize blood loss, stabilize the situation, and, ultimately just keep that patient alive.
Keep them going.
Yeah.
But obviously the body can't stay in emergency mode forever.
Right. Absolutely. So that takes us to what we call the flow phase.
Okay.
Now, this is where it gets interesting. There are two parts to the flow phase. We've got the catabolic and the anabolic. So think of the catabolic phase as the fight or flight response finally kicking in.
So it's almost like it's switching gears from conserving energy to actually trying to mobilize it. So what does that actually look like? If you were to look at the patient, what would we be seeing?
Okay, so you'll see a surge in those catecholamines we talked about, remember? Adrenaline's pumping, and the body starts pulling energy from wherever it can get it right. Fat, carbs, you might even see some tissue edema, the metabolic rate, cardiac output, oxygen consumption, all of that increases. And the liver's working overtime, churning out glucose through gluconeogenesis. Basically, it's creating energy from anything it can get its hands on.
Wow. So the body's really revving up its engines to repair all the damage that's been done during surgery.
Yeah.
But what should we actually be looking out for with our patients during this phase? What are the red flags?
Okay, so keep a close eye on those inflammatory markers. Things like IL-1, IL-6, TNF-alpha.
You're familiar with those?
Yeah, those are signs the body's working hard to heal, but this high energy state can also lead to insulin resistance, which makes it harder to regulate blood sugar. And we also know this is a time when, patients are more vulnerable to infections and even cardiac issues.
So it's almost like there's this really complex interplay going on.
Absolutely.
Between all the hormones and, the energy demands and everything. So it's a critical period. We need to be really monitoring our patients closely.
For sure.
But eventually, the body shifts gears again, right?
It does.
Into what we call the anabolic phase.
Yes. And this is where we kind of see the light at the end of the tunnel.
Yes.
Think of this as the recovery and rebuild phase. So we start to see weight gain, protein in fat stores replenishing, the metabolic rate kind of getting back to normal.
Thank goodness.
Yeah, exactly. It's important to remember, though, this phase can take a while. Weeks, even months.
Wow.
It really depends on the surgery and the individual patient. You got to think long-term with patient support here. Think about their nutrition. How can we encourage activity as they recover?
That's a really good point. So just to recap, we've got our ebb, our catabolic flow, and our anabolic flow. So how long does each of these phases typically last?
So the ebb phase, think of it like a quick dip, usually 24 to 48 hours. Catabolic flow follows, and that can last anywhere from 3 to 10 days. And then, as we said, the anabolic flow, that's the marathon. Weeks, sometimes months.
Right. So knowing this timeline, that's got to be super helpful for surgeons.
Absolutely.
For planning post-op care. Is there anything we can actually do as surgeons to make sure these phases progress as they should?
Absolutely. So there are a few things that can prolong that intense catabolic phase, delay the healing, make it all a bit harder. Think things like continued bleeding, if they're hypothermic, if there's tissue swelling, poor blood flow to the tissues, if they're not getting enough nutrition, keeping them immobile for too long.
So things that we can actively manage and address. We can stop the bleeding, keep them warm, get them moving as soon as possible.
Exactly. You've got it. And that's why understanding this whole ebb and flow model is so crucial. It allows us to be proactive. We can optimize our patient's recovery.
Right.
Minimally invasive techniques, pain management, Even medications like beta blockers and statins, these are all tools in our arsenal.
So we can really, as surgeons, make a difference in how the patient progresses through these stages. It's
Yeah.
not just waiting and watching.
It's active.
So big takeaway here for our listeners, especially those prepping for the MRCS.
Remember, minimizing that metabolic roller coaster, that's going to improve outcomes for your patients. And to do that, you need to really understand this ebb and flow model. Think about how this applies to real surgical scenarios, not just in the exam room, but when you're actually in surgery.
Yeah, it all comes back to that patient care, doesn't it?
It does.
Fantastic. Well, I hope you all enjoyed this deep dive.
Yeah, it's been a good one.
Good luck with your MRCS exams.
Good luck.
See you next time.
See you later.